Okay, so it's 6:40 and we are expecting Norman to jump on anytime between now and 7, so which we're all very excited about. So to start off, a bit of housekeeping. If you have any questions and you'd like the panel to answer, there is a Q&A button down below. Just hover your cursor over that and the Q&A will come up. If you would like to ask any questions directly to the panel, please click the hand raised icon. Again, you'll find that down below. Now, we'll try and get to some of you so you can ask those questions live of Norman, but given there's so many, we're not going to get round to everyone, I would have thought. Just let you know also that the session is being recorded and we will make this session available to you and your network and anyone else who is interested in this. We'd also ask that you ask any questions respectfully. We know that some webinars have been hijacked by trolls. I'm sure that won't happen here, but if that happens, we will just ignore that. So just to acknowledge that might be an issue, although I doubt it. We also know that there are a number of other issues besides the pandemic, including government funding and industrial relations that need to be answered. We won't be doing that today. We may provide webinars down the road though that will address those issues. Today's webinar will focus solely on the health impact of the pandemic on the public and the people in the sector. So to start, I'd like to acknowledge the Gadigal people of the Eora Nation. The Gadigal people and the Eora Nation is where I'm currently sitting at the moment in Alexandria in Sydney. They are the traditional custodians of the land, and I pay my respect to the elders, past, present and emerging, and pay my respect to anybody who's Aboriginal on the call today. My phone has just made a buzz. I'm wondering if that's Norman trying to get on. Excuse me. So welcome to the first in the series of webinars hosted by Healthy Australia. My name is Eugene McGarrell and I am the CEO of Healthy Australia. I actually grew up in the UK, you probably guessed that, but my parents weren't British, they were Spanish and Irish. They immigrated to the UK to start a career in nursing. And I started nursing in 1979 and have been working in health and community care for 40 years. Particularly focused on people who are vulnerable because of mental illness, poverty, abuse, neglect, and disability. Healthy Australia is a charity set up specifically to advocate for the rights of Australians to education, health, and safety. We believe strongly in the right to self-agency and the sovereignty of local neighbourhoods. Healthy Australia is committed to a strong early childhood education and care sector. And we see this as a fundamental strategy to achieving self-agency for all. Our guest in today's webinar is Dr. Norman Swan. Norman hosts the ABC's The Health Report, which he created in 1985. The Health Report is possibly the longest running health program in the English-speaking world. It appeals to both specialists and mainstream audiences by applying a broad definition of health and seeing health and medicine within social, scientific, and political contexts. Norman's core missions, in fact, are firstly to give people the information and insights they need to make the decisions about their health and healthcare. That's usually information that only doctors have had. And secondly, as a health journalist, and in the tradition of the Fourth Estate, his role is to hold those who provide the fund healthcare to account. So I first came across Norman about 10 years ago at a conference that he was hosting in New South Wales. And the purpose of the conference was to reinforce the need for clinicians to use evidence in their decision-making. Sounded quite unique at the time, but I remember thinking then that this guy knows how to make seemingly complicated issues simple. In my opinion, and in the opinion of many, Norman has been the calm voice of reason during the current pandemic. When he knows the answer to questions, he provides a response that we can all understand. And when he doesn't, and he doesn't know the answer, he says so. So when I asked Norman how much his rates were for appearing tonight, he said that he would do this for free for the sector. So we need to thank him for that. Also with me is Tamika Hicks. Tamika, in front of you, will be well known to many of you, I'm sure. Tamika is the founder and manager of Cardinia Lakes Early Learning Centre in Victoria. She is also a strong advocate for workers' rights in the sector. I had the pleasure of visiting Cardinia Lakes Early Learning Centre last year and was struck by the level of professionalism I encountered with every person I met at the centre, at the service. The passion for children and their potential is palpable, as I know it is across the sector. Tamika will provide a perspective directly from the sector throughout the session. So, to start the ball rolling, and while we wait for Norman, I wanted to ask Tamika how she was handling the running of the service during the pandemic, what changes she's made at work and at home, and what have been the major challenges that you have faced.
Thank you. Thanks for that introduction, Eugene. I think one of the, starting with the challenges first, because I think the challenge with the sector was the lack of information and the lack of what it is we should be doing to make our services safe and to make ourselves more aware of what we needed to know and what we could do and what things we needed to change to make every person who came through the door safe, and what that meant, and we didn't really have that to start off with. So that was quite a big challenge, and to an extent we still don't have all the answers that we need to give ourselves that sense of calm. There is still a lot of uncertainty and a lot of educators that are feeling quite uneasy about going to work each day. So just bringing that sense of calm to the workplace and some sort of process that we could implement that could hopefully stop anyone from coming through the door and potentially spreading this virus through the centre community. So a number of educators who were quite concerned right across the country came into contact with our union directors and said we need to pull together as a union and come up with something, some sort of process that we could all follow and be guided by, that would make our services safe, and to make ourselves have a process that we could follow, that we could implement. So we came up with a 6-point plan. United Workers Union, our early childhood education union for long day care, and this launched a couple of weeks ago. So I'm just going to pause for a second there. Eugene, are you getting things happening there with Norman, or will I just keep going?
I've just messaged him, so I'm expecting him any minute now. Okay. He said any time before 7, so.
Okay, great. So the launch of the 6-point plan gave a lot of us some a process and some certainty of what we could be following within our service. So for those of you out there who haven't heard of the 6-point plan, it just follows these points. So the first point was pre-entry screening, and I know a lot of services have questioned this. The rationale behind it is that if we're having a couple of educators in the foyer or the entrance of the service that are having conversations with families on how the child has been, how people in the family have been, whether there have been people in the family who have been travelling, whether people in the family have been ill, unwell, having a temperature, or showing those signs and symptoms that we know to be indicators of the COVID-19 virus. So those pre-entry screening for the union, for us, were having temperature checks, having those conversations with families, and making sure that educators are well equipped when those those conversations are happening. And if we know that it's been reported that children can be asymptomatic, so what can we be doing to look past the child that may be asymptomatic? And that is looking and having a conversation with the parents and carers of those children. So whilst the child might not have a temperature, the parent might have a temperature, or we know that, you know, another parent or someone who's living at the home may be unwell, and questioning, you know, if they've been on a holiday, or if they may have come into contact with someone who may have the virus. So those pre-screening checks are really important. The second point was to have adequate protective equipment. The staff at my service who are doing those screening checks wear the mask, because they don't know if the conversations and the children that are coming through the door are bringing in the virus. So there's been a lot of question and conjecture around the wearing of masks, but our staff who are on the front door doing those pre-entry screening tests have the masks on. Then I've got everything there, the digital thermometer and the gloves to make sure that they're protected. And then what we do then is have some educators that then take the children off to their rooms. So we're minimising the traffic that's coming through the service. And all of our parents were 100% on board with that. They understood that minimising the traffic in the centre was necessary, because if we did have that one parent that came into the service that may have had the virus, they could be going through, touching doors, doorknobs, etc., and spreading it on surfaces. So the pre-entry screening checks and educators taking the children from the foyer or the entrance into the room to reduce the traffic. The third point on the 6-point plan is the adequate cleaning. So making sure that we have a staff member that goes through and cleans all of the high traffic areas at least 3 times a day. So again, just make sure all of those high traffic areas, the surface areas, are clean and sanitised. The fourth point's adequate staffing. So we know that the department have come through with some recommendations on staffing and the square meterage of children, and just making sure that we've got most of the services out there would have a reduction in children and occupancy, so making sure that that's put to good use, and making sure that the cleaning's amped up, and that we've got it sort of runs in line with our point 6, which is staggered meal times and play times, to make sure that there's enough adequate staffing to make sure that social distancing, which in reality is pretty hard to do in our field, that what social distancing or minimal numbers and crowding can be implemented in the service. Point 5 was hygiene. So we know that normal protocol for early childhood is, that we do already implement thorough hand washing, etc. in the service. So what more could be done? So we took on the recommendation that if you're coming to the service from home, having showered with a clean set of clothes, that's fine, you come in and start your workday. But if you're coming via the gym, or you've done some shopping in the morning, or you've been somewhere else, that when you come into work, you would then get changed into a fresh set of clothes. And then point 6 is the staggered times. So staggered times around parent drop-off, making sure that you have your entrance area marked off with enough space for social distancing, so you don't have a lot of high traffic, that high traffic in the drop-off zone built up, that families are well voiced on making sure that they've got enough space in between. And that again comes with just communicating with your families about the process that you're going to have in place, or that you have in place with your parents. Yard play. One of the things that I know some services are doing, and it's not possible, like all of these things might not be 100% possible in your service, but if you have a shared yard, like what are we doing to separate and to keep rooms in their age group. So if one child does happen to have the virus, that we're trying to stop the spread throughout the whole service. And we know that that might not be the you might not be able to do that in your service, but in some services you can. Staggered meal times as well. And as we know, social distancing is very difficult, if not impossible, with some age groups. With the age groups that are, what are we doing in terms of trying to stop the build up in some play areas, for example, and restricting children, numbers of children that go in outside play, or if you are used to doing a whole group time with your kinders, for example, to break that off into smaller group sessions. And what does mat time look like, and different things like that to consider. So every service is going to have different settings. I know some services that conduct their kinders outside, like what does that look like? I know there was a question there from Doug about what does COVID virus look like on natural surfaces. So I know that that will be a good question to ask Dr. Norman when he does come on. And some of those questions around nails and jewellery and watches, bracelets, should those be things that we are leaving at home and not wearing? So this point plan is a great foundation for us to be following, and it's really good that the union has got on board and supported educators in giving us a platform and a process to be able to implement at our services.
That's great, Tamika. Thank you for that outline of the 6-point plan. I hear Dr. Norman Swan is with us. Are you there, Norman? No, maybe he's on mute. Okay, we'll work that out. There might be some tech issue to deal with. So, Tamika, what are the main challenges for you? I mean, a lot of services have, or some services chosen not to open, and others have. And you guys have been working on the 6-point plan. I think probably even 2 weeks ago you had this in place. What have been some of the major challenges for you in implementing it? And do you think there's more to be done? And while you're answering that, I'll find out where Norman is.
Yeah. So I think how far do we go in terms of restricting access for children? We've been very, very strict, right down to if a child has a bit of a runny nose, we've been sending them home and just making sure that children are 100% well before they come in. Also, the same applying for the staff. Hello.
Yeah, so hi Norman, how are you?
I'm fine, thank you. Sorry about this. I only belatedly got your message about 20 to 7.
Oh, that's okay. We sort of said that you might be here between 22 and 7 o'clock. So thank you very much for coming. I've done all the housekeeping and done your intro and bio and everything like that.
Right.
People are very excited to hear from you. Tamika has just outlined a 6-point plan that they've developed locally to keep the children and the families safe. Mm-hmm. And we were just moving on to the decision by some services to not open and some to open, and explore some of the challenges that is bringing to the services. And Tamika was just finishing off on that answer, and then we'll come to some. We've got a number of Q&As here that we'll go to for you, Norman.
Sure.
Yeah, I'll just Norman go over very quickly the 6-point plan that our United Workers Union has put out, just to give some sort of a platform and process for services to follow. So I've gone into a bit of detail for each of the 6 points, but I'll just go over the 6 points in general. So some pre-entry screening of temperature checks and conversations with families, adequate protective equipment for those who are doing those pre-entry screening questions and temp checks, adequate cleaning of high traffic areas throughout the centre during the day, adequate staffing to make sure that we don't have a build-up of children as much as possible, adequate hygiene. We already have quite a good protocol for hand washing and hygiene within early years services, but what more could we be doing in that area? and staggering times around meals and parent drop-offs, and not having parents walk through the centre to drop their children off and have them dropped off at that pre-entry screening point, so educators then take the children to the rooms to avoid high traffic areas. So that, in a nutshell, is what we've been implementing at a lot of services that have good union membership, and just to try and give us a bit of a procedure to make us feel safe, and to make sure that everyone that comes through the door, that we can try and reduce someone coming in with the virus.
So I guess as maybe a starter, Norman, maybe there's some reaction you have on that 6-point plan.
Well, if you go back to first principles with COVID-19, and I think probably a lot of people on the call on this webinar know a lot of this stuff, but if you actually, just to remind you, if you go right back to the studies of this epidemic and the modeling that's gone on right from the very early days, the one thing that makes the biggest difference to this epidemic proceeding is social distancing. Remember, we don't have a vaccine, we don't have treatment, and when you actually look at the effect of different things, so there's no question that testing makes a huge difference. I'll come down to childcare in a minute, but early childhood centres in a minute, but essentially testing makes a big difference, particularly if it's extensive. Strict isolation, strict quarantine, strict contact tracing of people who test positive, and maintaining that core, they make a big difference to the curve. But the thing that makes the biggest difference to the curve is social distancing. And of course, hand hygiene within that. And there are different elements to social distancing in terms of what you do as a community. You stop theatres, you stop large gatherings, football, and people congregating in anything more than 1 or 2 people. So the more you go out, the more likely you are to catch the virus. And just to put, is it worth my while just putting the epidemic in Australia into perspective?
Yes, it'd be great. Thanks, Norman.
So the area of controversy, which I'll come back to, is do you close early childhood, your preschool, do you close school? And I'll come back to that in a minute. What's happened in Australia is that we've had success, and the rate of growth is really slowing right down. And we may well be coming off our first peak. Hopefully it's our only peak, but let's say it's our first peak. And the reason that we've come off that peak is that we have stopped overseas transmission. So we've stopped importing people who are COVID-19 positive from overseas. Even with the cruise ships coming in, they've washed through the system. We're quarantining people strictly who come in from overseas, well, more strictly, not entirely strictly. There's a problem with the quarantining. But if you look at the graph and you analyze the graph, which looks like as if it's going like that, so I'll look at it in the camera. When you actually dissect what's under that graph, it's the overseas transmissions that have really dropped off. What hasn't dropped off is community transmission. And for the next week or so, most of that community transmission will be from contacts with people who've been overseas. A lot of it is asymptomatic, so people don't know they've got the disease and are spreading it. And a lot of it is from 20 to 29-year-olds, and not a lot of it is from children. So for some reason, let me come back to the children in a minute. So this graph is just going slowly up. It's not going like that. It's not going up exponentially. It's going up really slowly in low numbers. But that is the fuel for the fire. So the chances at the moment of coming across somebody in Australia with COVID-19 is relatively low unless you're in a hotspot. There are hotspots all over the place, eastern suburbs of Sydney, some country areas, and different parts of Melbourne, and so on. But this graph has, what we've got to do now is get that graph to bottom out, not flatten, but bottom out. so that we have largely eliminated spread in Australia. So we don't have that kindling that could be set alight if we suddenly relax social distancing, which of course people want to do. I mean, families are going nuts with their kids at home. People are, they're going potty, and it's very hard to maintain. But the control of the epidemic is very sensitive to social distancing. So if the community complies, say, 70% with social distancing, 30% of the time they're breaking the rules, they're meeting with other people, they're breaking that 2-meter barrier, et cetera, et cetera. At 70%, that graph keeps on going up. At 80 to 90% adherence to social distancing, it starts to tail off. And if you associate that with very extensive testing, that's testing everybody in Australia with symptoms, not contacts, not nothing, just you've got symptoms, you get tested, which is what's happening in Western Australia. And it's happening in hotspots in other parts of Australia where they're really going in and intensively testing. You get that graph down. So for us to relax social distancing, we've got to get down to very, very low or zero levels of transmission. Now, even zero levels of transmission, there will still be people in Australia with COVID-19, and it will still be spreading in the community, but at a low level, and hopefully we can keep that under control. And that's when we can start to relax social distancing. So that's the story. So in an influenza pandemic, the first thing you do is you close preschools, early childhood centers, and schools, because in influenza, kids are super spreaders. You can't, it's very hard to maintain social distancing. They catch everything that's going. It's very hard to be super hygienic. And the kid, and there is something about the immune system of kids that makes them excrete a lot of virus. So kids are super spreaders. In this epidemic, they're not. So about 10% of infections come from kids, which is quite a lot. But it's not huge. It's not as huge as influenza. Hence the debate about, do you close schools? Do you close early childhood centers? And that's a societal, social trading off. If we went for full lockdown in Australia, you would. There's no question about that. And leaving schools and early childhood centers open is a compromise for people's lives, for kids. You know the story better than me. So that's where we stand. Now, if we are lucky in Australia, we can get down to those very low levels actually quite quickly. And then the question is whether you relax them. But when we relax them, it's not back to normal. What they might do is say, okay, schools can go back, and then they'll watch what happens for a couple of weeks. And if we don't get a flare up, then they'll say, well, maybe cafes can open, but with social distancing. We won't return to normal for a long, long time to come, and there won't be any overseas travel for a long, long time to come. But we're talking about relaxing things internally. And it is risky because you've got that kindling there, and it won't take much for very small numbers to become very large numbers very quickly. And that's what's happened in Italy, it's what's happened in Spain, in France, in New York, and the other parts of America. It just happens frighteningly fast when you let your foot off the brake. So what it means is, assuming that this sector remains open, which I'm pretty sure it will, is that even when we're starting to relax and you can go to a cafe and sit down and have a cup of coffee, albeit separate from other people, and maybe you can have people around for dinner, there will still be the requirement to socially distance, because it is a high-risk population, even though it's lower risk than influenza. And if you look at the illness that they get, it's true that they get a mild illness, but babies, so those doing family daycare, for under 12 months, they can actually get quite serious illness. And there have been children who've died, but it's very unusual, very rare. It is older people, but when you get large numbers flowing through the system, you get the odd child, and there has been the occasional death in young children, but it's very occasional. In the million or so cases, you can probably count it on one hand, if indeed that. And so the 6 points that you talked about are things that are going to be business as usual for the foreseeable future. And it would be the absolute minimum. And it is about, kids are going to play together. It's very hard to stop that. But screening with temperature makes a lot of sense. You do not want any parent with symptoms to bring a child in. The child's got to stay at home because the parent has got to commit to getting tested. So I think there has to be a deal with parents, which is if you have symptoms, we need you to get tested. And then if they are positive, then the child cannot come to preschool and the child has to go through quarantine, however that is going to happen. I mean, this is horrendous stuff. So I would say that there should be an insistence on testing. There should be no staff member should come with symptoms. I mean, that's probably part of your protocol already. And temperature checks, I think, is wise because fever is almost universal in COVID-19. And so fever is crude, but it's a way of picking up people's problems. Sorry, you can't get in and your child can't get in. This is tough times. You've got to, if you want this preschool or this early childhood center to be available for you as a family, here's the deal. And you've got to accept temperature testing, and it's going to be intrusive because once it gets in, it will run riot.
Yeah.
It will run riot. Kids won't become very sick, but it will run riot, and staff will catch it. And you can do all you can. So you've got to be cleaning with weak bleach or strong detergent or alcohol solution, or have all that available. Gloves are a waste of time in my view. I mean, probably be questions about gloves. I mean, if you've got a protocol already before you started this about gloves in certain situations when a child's vomited or something like that, that's fine. I'm not going to get in the way of that. But if you're wearing gloves to prevent COVID-19, unless you're changing the gloves after every child contact, there's no point. Yeah. Because gloves are just going to pick it up and you'll touch your face and you'll spread it to your face. There's nothing magical about gloves. So in hospital situations, when you wear PPE, you get rid of it after you change it over, or every session you change it over. So you're much better having hand hygiene where you touch a child, you touch a surface, you then wash your hands. You wash your hands between kids, which almost certainly was your protocol anyway, but now you've just got to be much more assiduous about it. You've got to wash your hands for longer in foaming soap. It doesn't have to be, it can be non-soap liquid, as long as it foams and you wash it for a long time. And if you don't have that, then 70% alcohol, hand sanitizer. And you've got to do as best you can. What you do about social distancing between children, you're not going to be able to do it. This is part of the deal. But all you can do is have hygiene about which kids come in and so on. And then often the question is, well, should staff wear masks? Well, masks are there to protect other people from you. So I'm assuming you're not going to allow staff to come if they've got symptoms of a cold or a fever. But then you've got asymptomatic people. So if you have everybody wearing masks and somebody comes and they don't know they've caught it and they're in the 2 or 3 days before they've caught it, and they're wearing masks, they're less likely to pass it to other members of staff or kids. But you're not protecting staff that much by wearing masks. So you're protected a little, but the real function of masks is to stopping spreading it to other people. And so you have to make your own mind up about masks. Then you've got to change masks every 2 or 3 hours, because as soon as they get damp, they're useless. And then people say, well, what about cloth masks? Well, I'd urge you to listen to my health report of last Monday, where we had Rana McIntyre talking about a randomized trial of cloth masks versus surgical masks that they did in Vietnam in healthcare workers. And the rate of infection increased in people wearing cloth masks. because they get wet and you inhale the thing, the bugs. If you want to wear masks out in the public, then you should use it with a waterproof material that does not absorb water. So making a mask out of a disposable nappy is not a good idea because they're highly absorbent. People talk about vacuum cleaner bags being quite good. But it's about you not spreading it to others rather than you not catching it. I mean, the environment in which you're working is a difficult environment, but the risk is more to staff than it is to children, really. And staff can protect themselves by you filtering the kids who are coming in as safe as possible, having maximum hygiene. You're absolutely right. Surfaces have just got to be cleaned constantly. And you just hope for the best that it doesn't get in. And I think if you do a lot of that, it'll be very unusual for it to get in, particularly if we get down to very low levels of COVID-19 in Australia. Then the chances that one of your parents has got it, but you might well find yourself in a centre at Bondi Beach or Mornington Peninsula or another place where there's a hotspot, in which case the chances are much higher. And you've really got to make a strategic decision with local government or others. Do you close for a while things get under control? Or do you just become super, super careful? I don't know the right answer to that question.
Thank you, Norman. There's a load of questions that have been asked in the Q&A, so I might just merge a couple.
Can I jump in while you're looking for some questions, Eugene?
Yeah.
So I think the number one thing to report back to everyone who's watching from the sector is that pre-entry screening is so important. Having those temperature checks with parents, staff and children are really important, and more so having the conversations with the families when they're dropping off their children of what's happening at home and is there someone at home who's sick. Because we are all so well, we know full well that we have what we call, Dr. Norman, the dose and drop. They dose them up with the Panadol in the morning and then they drop them off for the day. That we can't have that, because that dose and drop may well be an indicator of the virus, especially if people in the family are sick. And then that dose and drop could be what breaks the chain of safety in your service. So the pre-entry screening is really, really important for educators to
parents have to be told bluntly, if they break the rules, the centre could simply close down and it's not available to them or anybody else, and for the sake of an extra day at work.
Yeah. And I think we'd love that message to come directly from government, that this is what we need now in early childhood and in kindergarten settings as well, because it's very easy to monitor in schools. Well, it's a lot more easier to monitor in schools than what it is in early childhood, where we have these children who don't speak, who can't tell us what's happening and how they're feeling. To really make sure that it's put onto the parents, that it's them that are keeping everyone safe, and for the sake of a day off work or for going and getting tested, that it's for the sake of the whole community.
Thanks, Tamika. There's a number of questions here about transmitting the virus through objects. So one question here is it safe to send letters from our kinder children to the elderly residents at a local aged care home?
Well, so you know what I'd do about that? I would put a delay on the transmission of the envelope. So the current best evidence about paper and cardboard is that the virus will last for about a day on it. So it lasts for about 3 days on plastic and glass, stainless steel, hard surfaces, but on softer surfaces it lasts less long. So if they're writing to people in a residential aged care facility next door, then I would get them to write on it. I wouldn't put it in the envelope. I'd leave it all out, and I'd leave it for a full 24 hours, and then somebody who's just washed their hands would put it in the envelopes and then take it, then the likelihood of any virus being on those envelopes is really low. The risk would come is if it's done on the same day, the kid sneezes all over them, they're in the envelope, and 2 hours later they get delivered to the aged care facility. But if you put a delay on it, and it only has to be about 24 hours, it's going to be safe.
Great, thank you. Another question, there's a few questions about flu, but one here about the AHPPC recommendations for flu shots and why they got watered down, and did you feel that this was watered down because it was cost to the government? This is the recommendation that everyone should have a flu shot by May the 1st, I think, otherwise they wouldn't be able to access early childcare. So the question to Norman is, what do you think about the need for flu shots for educators?
Everybody should have immunization against flu, including kids, and without question. And by the way, before I get into COVID-19 and influenza, anybody watching this who's pregnant women, regardless of COVID-19, regardless of the time of year, every pregnant woman needs to be immunized against influenza. It's a safe vaccine, and you do not want to be getting influenza if you're pregnant. So that's the first thing. Now we come to COVID-19. Everybody needs to be immunized, and immunized, ideally in the month of April, so that because it looks like being an early season. But if it goes into May, it goes into May. I wasn't aware of it being watered down. I suspect there's a supply chain problem, and some areas are running out of vaccine. I think that's probably what's going on, and therefore it's pragmatic. But the ideal would be between Easter and the end of April, you are immunized against influenza if you can at all get it. But if it's a week or so later, so be it.
Okay.
Everybody needs to be immunized. And just in case you're wondering why, it's that this is preventable. People do die of seasonal flu, not at the same rate as COVID-19. You do not want to arrive in an emergency department with influenza and it's all blocked because of COVID-19 if you're really sick. So you want to prevent that. You certainly don't want to get influenza and COVID-19 at the same time, and that's possible. So for all those sensible reasons, everybody needs to get immunized in the community.
Great, thank you. Question here from Jackie Harley. Should we be limiting the children with asthma from attending? Are they a risk group?
No.
Okay.
No. The key with asthma is when there's things going around, as every early child educator knows, that when a kid gets a cold and they've got asthma, the asthma gets worse. So the key here is to pick up on kids who are wheezing. So they're running around in the playground, they're doing their thing, and they're coughing and wheezing. And they've got asthma. If they're coughing and wheezing, then it means their asthma is not well controlled. And yeah, they are at increased risk if they were to get COVID-19. So it's not a question of eliminating, they're not at any more risk of catching COVID-19, but they're at more risk of getting a problem. So you absolutely would not eliminate a child with type 1 diabetes, with asthma, or any condition at all. There needs to be some thought given to cystic fibrosis. But if the pediatrician looking after the child gives the child the okay, then that child should come to the center. They're not going to put other children at risk. And so if a child's wheezing and coughing, the parent needs to be gently spoken to and taken to the general practitioner because the child is not well controlled. And if they were to get COVID-19, they're more at risk. Not risk to anybody else, but just to themselves. So you just got to have a low tolerance for symptoms.
Great.
Can I jump in for a second?
Yes, Tamika.
I know there's a lot of questions coming up in the chat around thermometers, and I know for a fact that it's really hard at the moment to get a forehead digital Zappy thermometer, and I know that there's a lot of profiteering happening on eBay with thermometers. So I think that that's something that as a sector we need to really rally and lobby the government for helping us try and get some stockpiles of thermometers in place. So we can't be doing the underarm thermometer to everyone who comes through the door. That's just going to bank up.
There are the ear ones.
Yes, and the ear ones as well.
Yeah.
So
Right.
that's something that we need to do a little bit of lobbying, or not a little bit, a lot of lobbying around, especially if we want to make sure that that's a process and procedure that we're all wanting to put in place, that we've got that that resource to be able to do that.
But in the meantime, then it has to be symptom-based.
Okay. A question here from Andrea. Some services have been implementing no Play-Doh, no paint, no messy play. Is there a scientific basis behind this? Does the virus live longer in wet substances?
Probably does live longer in wet surfaces. Although, I just read something on this yesterday. Although it's actually, so let me just describe look, it probably does live longer on wet surfaces, but it lives, when it dries out, it lives as well. I mean, it survives in the fridge and it survives in the freezer. It's extreme heat that gets rid of it. By the way, not hot drinks, that's a myth. Forget that one, you've all seen it on the video. But how much do you restrict normal activity? If you're doing the sensible stuff and you're screening before they come in, and there's a low chance the kids have got it, do you get rid of Play-Doh? The reality is that Play-Doh is unlikely to be a surface that survives on very long because it's rough, it's soft. Yes, you've diluted it in water, but the answer is, I don't know the answer to the question, but I think you just got to be a bit careful about, so does that mean then that you don't allow the kids to paint with water paint?
Mm.
Well, what are you left with?
Mm.
So I just think that you've got to take a small degree of risk here and have everything else safe. And when you touch the paintbrush, it gets cleaned with alcohol or detergent. And you're cleaning obsessively. The chances that you're going to get spread into Play-Doh, I think, is really, and you've probably got protocol for changing over the Play-Doh anyway. That's not going to lie around for a week. You change it over anyway.
And I think that's a really good point, that I think because there's been such a lack of direction and guidance to the sector, that everyone goes into a bit of hyperdrive, because at what point do we start and what point do we stop? And I think we need to try and get a ground where everyone's happy that is there's a non-negotiable level of what we all need to implement as a sector across the country, so everyone has that sense of security and that feeling that that's the safest thing that we can do for now, because it is always going to be in the community, and we need to children need to play, and children need to be creative, and they need to be into messy play, and they need to experience all the things that children need to experience to grow and develop. And we know the first 5 years are formative. We know that they're the most important, vital years to the foundations of development, and we don't want to hinder or impede on that. And even with excursions, going out to parklands, bush kinder, we don't want to be restricting those things for children. And I think if we've got that pre-entry screening in place, and we have a really good relationship with our parents and the understanding of how important it is for them to be accountable to whether or not their children come in, if there's a sickness in the family or not, is the main thing that we need to secure and that we need to advocate for and make widely known within the community, with children coming into long day care, family daycare, and kindergarten.
So there is an issue, I think, though, with taking the kids out of the centre. And I know that you've got the rules and you keep them under control and so on, but particularly if you go into Parkland, it's likely that there are elderly people there. And remember, there is the chance that those kids can spread to those people. So if you do take kids out into public areas in sort of large clumps of kids, large groups, largest groups, they can't go and interact with older people. You've got to keep them away so that the group is socially isolated. Otherwise, that is risk, even though there's a small risk, and even though you're doing all the right things, we've really got to protect older people in the community. So if you're out in a public area, there's got to be really a sense of a social distance between the group of kids and everybody else. And that's got to be policed.
Thank you, Norman. There's a question here from John Ledger. Can you explain about herd immunity? I'm not comfortable exposing children and staff in order to increase herd immunity.
Well, you're right. So this is, okay, herd immunity is what we get with immunization. Why we shoot for very high levels of immunization is so that you've got 80, 90% of the community covered for polio, measles, mumps, chickenpox, tetanus, and so on. And that, well, tetanus is a separate thing because you get it from the soil rather than from other people. But the idea here is that we as a community are immune, and therefore you drive down the incidence of incidence and prevalence of those diseases down to very, very low levels, because there are very few humans in the community that these diseases can affect. So measles now these days is largely imported from overseas. There are parts of Australia like northern New South Wales where there are very low levels of immunization. There are low levels of immunization in some of our most affluent suburbs, and therefore you have fertile ground for these infections to take off. And the idea here where you don't have a vaccine is that enough people get infected that there isn't the raw material for the virus to reproduce in. And the question is, what is the level of herd immunity where that occurs? And you might have heard 60% bandied about, but a lot of people don't believe that you'd get effective herd immunity at 60%. It's probably got to be up at 80%. And that was the misguided policy of the Johnson government in Britain. They were going for herd immunity. And I think, to be honest, there were some people in the Commonwealth and business community who thought it was a good idea here. The problem is, and it's in front of you on the headlines every day of the week, is that when you let this go, it's uncontrolled. It's a forest fire, but it's a forest fire you cannot see. And it spreads like a forest fire, like wildfire in the community. And there's no way of controlling it. There's no treatment, there's no immunization. And in the process of going to herd immunity, people die. And they die in large numbers. And not only the general community die, doctors and nurses die, because 20% of infections are in people like that. And of course, I would expect that early childhood workers are high risk too, because you're in close contact as well. And that's what happens. It goes out of control. And in the process of getting herd immunity, you're willing to sacrifice thousands of lives. So don't let anybody try and talk you into herd immunity. It's not going to happen anytime soon, because we're not willing to sacrifice the lives that it will cost. And they're not just elderly people's lives, it's people in their 30s and 40s and 20s, and even some children. Mm. So you're right to be uncomfortable about that.
Great, thank you. One final question is, there's a whole range of questions here about clothing and taking the shoes off before you come into the service, maybe needing to change clothes, going into work and coming back from work, taking a shower. Are these sort of arrangements really needed, or is that overkill?
Well, there's no question if there's SARS-CoV-2 viruses around, it does go onto clothes, it does go onto your shoes. And washing clothes does get rid of the virus. So I think the risk is very low, but what's the harm? Assuming, the trouble is you end up spending your life ironing and washing. So I understand that. The dryer's going the whole time. So I understand the impracticality of it, particularly in a low-paid sector where people are often sharing houses and it's fine. You've got a big house with a garden, you can hang it out to dry. But in an apartment that you're sharing with 3 or 4 other people. But it's not a silly idea to take off your shoes at the door and change your clothes after being it is a relatively high risk environment, early childhood. You can minimize the risk, but it's still high risk. And and if you feel that you don't want to bring it home, then by all means, then just take off your clothes and wash them, and wear shoes that you can actually wash with detergent, rub down with detergent or spray with alcohol. Just a standard cycle with detergent is all you need. It'll kill the virus.
Great, thank you. Well, look, we've got only 5 minutes to go, so I'm just going to wrap up now and wrap up by, first of all, thanking Tamika and Norman for your time. And as usual, Norman, your answers are so easy to understand. It's like, yeah, of course, that makes sense. And for me, and I'm sure for everybody else here, there's some questions that have been really clarified for us, so thank you. I also know and remind everyone, I mentioned it before, that you've done this for nothing, that you agreed to do this to invest in the sector. And just as Easter starts, and I know how busy you are, so I wanted to thank you very much for contributing your time and for investing in the sector as you have.
Let me say one thing that I meant to say earlier, and that it's probably no surprise to anybody working in this sector, because you're talking to kids all the time. But we called for questions from kids. They record it into the parent's smartphone and email it in. We've had 500 or more children sending it in, and they're very young children. 4 years old, 5 years old, 8 years old, the occasional 12-year-old, but they're really young kids. And these kids are aware of COVID-19. They're thinking about it. Even really young kids. I mean, I don't know, 4-year-old. We've got a bonus children's episode on CoronaCast on Monday, and a little 4-year-old phoning up. Now, you don't know whether they've been prompted by the parents, but the kid's saying, I'm doing all the right things, but I'm really worried. When do I get to see my grandparents? Your heart bleeds. And one little boy, an 8-year-old boy, rang in. The parents must know that he sent it in, and his name was Huck, and he was in Victoria, and he said, "Is my whole family going to die?" And that's what these kids are thinking, and they might not be saying it.
Yeah.
And you just want to cry. And when a kid asks you that question, the world stops, and that kid is the only thing in your world until you've answered that child's question. And I think you shouldn't underestimate the emotional world of these children, where they're watching this stuff and the media is talking about this deadly virus, and you're seeing these headlines about New York and everywhere else. They might not be articulating it, but they might be thinking about it. And of course, the answer for these kids is, no, your family's not going to die. And you can say that with utter confidence, because the kids are young and their parents are young. And they might get it, but they'll be just fine. And you can really say, as a worker, you can say that with confidence. And they say, what about my grandparents though? And you say, well, they are at more risk, and that's probably why you need to stay away from them for a while, so that they're protected and we look after you, Nana and Pop. But some of your kids are thinking this stuff.
Yeah.
Well, it's really important to have the discussions with children. There's a great episode of Play School on ABC talking about COVID-19. There's some great resources, free resources out there, books to read to children, especially very young children. And I think it's something that maybe, again, I know the federal government and state governments are under the pump at the moment, but trying to pull some resources together for early childhood and for schools to make sure that we're looking after the mental health of young children.
Yeah. So thank you, Norman, and thank you, Tamika, for your time too. I know how busy you are too, Tamika, and I appreciate you coming on and giving us a real perspective from the sector. Healthy Australia is going to be holding a series of webinars after Easter. and we want to hold webinars that are useful to people in the sector. So if you have any suggestions for topics, panel members, please let me know. If you're keen to be a panel member, please reach out. Be happy to do that. So once again, I'd like to thank Norman and Tamika, and I'd like to wish you all a very happy, safe, and stay-at-home Easter. So thank you very much. Thanks, guys.
Bye.
Thank you.
Bye now. Bye.